WAYRILZ is approved for adults with persistent or chronic ITP who received a prior treatment that did not work well enough. So this study that ultimately led to the approval of WAYRILZ looked at adults who had what we call chronic or persistent ITP. It's important to know that the patients who were enrolled in this study either had failed to respond to prior treatments to their ITP or they were not tolerating these treatments. This study, the LUNA-3 trial is the name, actually compared 133 patients who took WAYRILZ compared to 69 patients who did not, and this was looked at over a 6-month period. Out of the 202 participants, 93 patients had 5 or more unique prior ITP therapies. Additionally, 51 people had between 3 and 4, and 58 had between 1 and 2. The most common prior ITP therapies included steroids, TPO RAs, IVIG or anti-D immunoglobulin, immunosuppressants, and splenectomy. As part of the study, what we were really looking for was improvement in platelet counts after 3 months on therapy with WAYRILZ, and this had a very stringent definition. We wanted to see a target platelet response of at least 50,000 or between 30 and 50,000 if the platelets had doubled from their starting point. And what I will tell you is that in both groups, they did have very low platelet levels, kind of in the teens, right around 15,000. And we were looking to see these improvements really as a result of WAYRILZ alone. These were, they could not be due to what we would call rescue therapies. Interestingly, on this trial, patients were able to stay at stable doses of certain treatments, including steroids and some of these TPO receptor agonists. So patients who did have this improvement in platelet count, hitting that 50,000 number, or 30 to 50,000 with the platelets doubling from their initial number, were called responders. And patients needed to be in that responder category in order to complete the full 6 months of the study. What we see is that 64% of patients, roughly 2/3 of patients who were taking WAYRILZ, met these criteria versus only about 1/3 of patients, or 32% of patients, who were not taking WAYRILZ. So the study's main measure was durable platelet response. And by the end of the 6 months on the trial, WAYRILZ showed improved and sustained platelet counts over time in some patients. During the last 3 months of the study, doctors evaluated how many patients were able to reach a platelet level of 50,000 or higher more than 5 times when measured weekly without needing any of these rescue treatments. And during this period, 23% of patients taking WAYRILZ met this goal, compared to no patients who were in what we call the placebo group, meaning patients who may have been on stable doses of some of these, steroids or TPO targeted drugs, but were not on WAYRILZ. And so this was certainly, a substantial difference. And I think to put these results into context, we really want to keep in mind that patients with WAYRILZ oftentimes had no other options. They had either tried and failed or could not tolerate, sometimes, again, 5 therapies or more. In this study, patients who were taking WAYRILZ reached their target platelet count in just over 5 weeks, so right around 36 days. For those who responded, their platelets tended to increase a little quicker. Usually we saw a platelet count response in patients who were ultimately going to meet that responder category in about 2 weeks. Now we'll look at how long platelet levels were maintained during the study. So on average, patients taking WAYRILZ kept their target platelet levels for about 7 weeks, compared to less than 1 week for patients who were not taking WAYRILZ. By 6 months on the study, patients taking WAYRILZ kept platelet counts at desired levels for a longer time compared to those who were not taking WAYRILZ. Another part of this study did look at how often patients who were on treatment needed rescue treatment. So things like IVIG due to a sudden and dangerous drop in platelet count. Not surprisingly, patients who were taking WAYRILZ needed fewer of these rescue therapies compared to patients who were not taking WAYRILZ. About 58% of patients who were not receiving WAYRILZ did require these rescue therapies. This was not just kind of, the provider or the doctor walking in and saying, "How are you feeling today?" This was measured using a tool called the ITP PAQ. And so this is a survey that has previously been kind of looked at and validated specifically in patients with ITP. So patients had to fill out this survey at the start of the study and at month 6, and this really measures of how ITP affected different areas of daily life. These included energy, mood, and sleep. For each of these categories, patients' scores were rated on a scale of 0 to 100. Higher scores meant that they were feeling better in that area. What we see is that at 6 months, patients who were taking WAYRILZ reported greater overall improvement in quality of life scores compared with those not taking WAYRILZ. In fact, if we look at the numbers here, we see an average increase of over 10 points for patients on WAYRILZ versus only a little over 2 points for patients who were not taking WAYRILZ. It's important to note that these results reflect how participants reported feeling during the study. Because I think it's so important as a patient to be informed about what we need to be on the lookout for when taking WAYRILZ. And we do know this because this data was also collected as part of the clinical trial that compared WAYRILZ to the sort of placebo treatment. And what we see is that the most common side effects that were reported by patients who were taking WAYRILZ mainly involved the gastrointestinal tract, and these included diarrhea, nausea, headaches, stomach pain, and some COVID-19 was reported as well, not necessarily triggered by WAYRILZ, but because it happened on the trial, it was reported. Now, it's important to know that taking WAYRILZ with food can actually help to minimize many of these side effects, particularly the diarrhea, nausea, and stomach pain if you experience them. It's important to know that not everyone who takes WAYRILZ is going to experience a side effect. I have to say, I have some of my first patients on WAYRILZ. The other day I saw one of my patients with a critically low platelet count who's recently started on WAYRILZ, and I asked him about any of these GI side effects, and luckily this particular patient wasn't having anything. But I do think it's important for my patients to know that these side effects are a possibility, and I really want to kind of let them know what to look out for.
In summary, WAYRILZ offers long-lasting platelet control and was studied for impact on patient-reported quality of life. WAYRILZ improves and sustains platelet counts. People taking WAYRILZ reported impact on quality of life. Important safety information. What should I tell my healthcare provider before taking WAYRILZ? Tell your healthcare provider about all of your medical conditions, including if you have liver problems, have kidney problems, are pregnant, or plan to become pregnant. WAYRILZ may harm your unborn baby. If you are able to have a baby, your healthcare provider will do a pregnancy test before starting treatment with WAYRILZ. Females who are able to become pregnant should use an effective birth control during treatment with WAYRILZ, and for 1 week after the last dose, are breastfeeding or plan to breastfeed. Do not breastfeed during treatment with WAYRILZ, and for at least 1 week after the last dose. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking WAYRILZ with certain other medicines may affect how WAYRILZ works and can cause side effects. WAYRILZ may also affect how other medicines work. What should I avoid while taking WAYRILZ? You should avoid grapefruit, starfruit, and products that have these fruits, and Seville oranges, often used in marmalades, during treatment with WAYRILZ. These products may increase the amount of WAYRILZ in your blood, which increases the risk of side effects of WAYRILZ. What are the possible side effects of WAYRILZ? WAYRILZ may cause serious side effects, including serious infections. WAYRILZ can increase the risk of infections, including serious infections that can lead to death. Your healthcare provider will check you for signs and symptoms of infection during your treatment with WAYRILZ. Tell your healthcare provider right away if you get any signs or symptoms of infection, including fever, chills, or flu-like symptoms. Liver problems including drug-induced liver injury, DILI. Liver problems, which may be severe, life-threatening, or lead to death, have happened in people treated with Bruton's tyrosine kinase, BTK inhibitors. Your healthcare provider will do blood tests to check your liver before and as necessary during treatment with WAYRILZ. Tell your healthcare provider right away if you have any signs or symptoms of liver problems, including stomach area, abdominal pain or discomfort, dark or tea-colored urine, or yellowing of the skin or the white part of your eyes. The most common side effects of WAYRILZ include diarrhea, nausea, headache, stomach area, abdominal pain, and COVID-19. These are not all of the possible side effects of WAYRILZ. What is WAYRILZ? WAYRILZ is a prescription medicine that is used to treat adults with persistent or chronic immune thrombocytopenia, ITP, who received a prior treatment that did not work well enough. It is not known if WAYRILZ is safe and effective in children. Please see accompanying full prescribing information, including patient information.